Many people wonder what the purpose of the spine is, and it serves several different functions. The first is that it does give support and keep us upright. When we think of animals in nature, your head typically is the highest area, and it gives you a clear vantage point to see where you might eat or who might eat you, which is important to know. We're very similar. We have our head upright so we can see what's around us for a lot of different reasons. But it also serves to protect the nerves, to protect the spinal cord. If you think about it, your spine is made to move, but it's also made to protect your spine. It's almost like, in a way, sort of like internal armor. So it lets you move, but it also is protecting the nerves and the spinal cord itself. Many people ask what they can do to help keep their spine healthy. Some things that I don't think are successful, although they may be touted by different professionals. Drinking water. So the thought would be if you drink water, your sponges might act like a disc and suck in the water. But the problem is your body is so good at regulating water that if you take in excess water, it's not going to get sucked in specifically to a disc that might need it. It's going to get flushed out of your body by your kidneys and by maintenance of your blood pressure. So doing that doesn't help. Some people will ask, is it important to apply traction to keep your spine healthy? I don't look at traction as something that helps specifically with spine health. But if it helps a person with back pain, then it's a good thing. And some will even ask, should they have professional, what's called non-surgical decompression? And I think that would be okay if it helps with your symptoms. I don't look at it again as whether it's helping your spine specifically to be healthier, but if it helps with your symptoms. But first, I suggest a person either hang from the monkey bars at school, because your body weight can give you enough traction to help with your symptoms. And other people will ask, what about that hang upside down device? And I think that also is okay, but we can't tolerate hanging upside down for long periods of time. So to do that as a long-term approach, say 20 minutes 3 times a day, your head might not tolerate that. But if you're hanging upside right, aside from weak arms, you could hang all day. And you can get the same overall effect for symptoms. And again, not necessarily for health. As far as health for the spine, we know that smoking is associated with disc problems, and it probably destroys the microvasculature that's important for maintaining a healthy disc. Excessive weight, I think, is a big contributory factor. And I don't think, say, 10 or 20 pounds overweight is going to make a big difference. But unfortunately, some patients, probably without recognizing it, become excess of 350 pounds, and that does take its toll on your discs. If you think of your discs as shock absorbers in a way, if you have shock absorbers in your car and you're riding on a bumpy road and carrying heavy loads, they're going to wear out faster than they would otherwise. And I think it's the same thing with the discs. They're just designed to take a certain amount of load and last a certain amount of time, and if you abuse them, they're going to wear out sooner.